brings you into the clinic?
I think I have a sinus infection, and I definitely need an antibiotic. My nose is stuffy, and I have a headache. I've been coughing and sneezing so much. My throat hurts. I'm miserable.
Okay, well, let me ask you a few questions so we can see what's going on. When did your symptoms begin?
3 days ago, and it's really bad today. Really bad.
Do you have any other symptoms other than what you told me? Like nausea, vomiting, a productive cough, wheezing, or pain or pressure in your face?
No, but I had a fever yesterday. My temperature is 100.5. And I did notice today my snot looks yellow when I blow my nose.
Does anything seem to make your symptoms worse?
They're worse at night. My nose gets more stuffy and I cough more. My throat also hurts more when I wake up in the morning.
Okay. Does anything make your symptoms better?
I took some cold medicine last night, and I think it helped me sleep a little bit better because my nose wasn't stuffy.
Have you been around anyone else that's sick?
Yes, my brother was sick last week, but he's all better and I'm so much worse than he was.
Well, Sally, it sounds like you have an upper respiratory illness, or what you might call a common cold. Colds typically last 5 to 7 days, with the peak of severity being around days 3 to 4. You should notice your symptoms begin to improve in the next couple of days and disappear by day 10.
So, are you going to give me an antibiotic or what?
No, a cold is a virus, which is not treatable by antibiotic. Only bacterial infections can be treated with antibiotics. Instead, we're going to treat your symptoms. This means that you need to get more rest and drink plenty of fluids. You might also use a cool mist humidifier or saline nose drops to help relieve some of your congestion. You may also continue to use the over-the-counter cold medicines to relieve some of your symptoms. Most importantly, make sure you wash your hands frequently, especially after you cough, sneeze, or blow your nose. Hand washing is the most effective way to prevent colds. Do you have any questions for me, Sally?
No, I understand now that an antibiotic wouldn't help me because I have a viral infection. I'm going to go home and rest now. I think I'll feel better tomorrow.
I think so too. Have a good day. Hi, Harry. My name is Susie. I'm the nurse practitioner seeing you today. What brings you into the clinic?
I think I have a sinus infection and I need an antibiotic. My head feels stuffy and I have a headache. I have a cough and lots of drainage in the back of my throat that is making my throat sore. I just don't feel well.
Okay, well, let me ask you a few questions so we can see what's going on. When did your symptoms begin?
They started about 2 weeks ago. I thought I just had a cold, but I'm just not getting any better.
Do you have any other symptoms other than what you told me, such as nausea and vomiting, a productive cough, wheezing, or pain or pressure in your face?
My face does hurt over my cheeks and around my eyes, and I've noticed that my teeth hurt as well. I have been coughing up thick yellow and green sputum. I've also had some fevers on and off. The highest one that I took was 101.5.
Does anything seem to make your symptoms worse?
Pushing on my face makes it hurt more. My symptoms also seem to get worse at night when I'm laying down.
Okay. Does anything make your symptoms better?
I've tried several different cold medications, but they don't seem to help me. When I take a shower, the hot steam makes my sinuses open up more.
Have you been around anyone else that's been sick?
A few weeks ago, my wife had a cold, and I thought I caught her cold. But I don't think this is a cold because it's just not going away.
Well, Harry, it sounds like you have a sinus infection. A sinus infection is caused by bacteria, so I'm going to prescribe an antibiotic for you. Your symptoms should start to improve over the next 2 to 3 days. Even though you may seem better, continue to take your antibiotics for the prescribed length of time. Ending the medication too early could cause the infection to return. To treat your symptoms, you may use ibuprofen or acetaminophen to relieve your headache and sinus pain. You may also try a cool mist humidifier or a saline nasal rinse to help with your congestion. Do you have any questions for me, Harry?
No, thank you so much for explaining why I need an antibiotic. I understand that if this was just a cold that was caused by a virus, then I wouldn't really need an antibiotic. Since I do have a bacterial sinus infection, the antibiotic will help treat me. I'm going to get my prescription filled and go home and rest.
Sounds good. Have a good day.